Welcome, everyone. I'm really delighted to welcome you to our patient town hall on COVID vaccination in children, about third doses, and so much more. We're really looking forward to answering your questions today, and we have a terrific set of panelists to help do so. Next slide. I'm going to start by acknowledging the land in which we gather upon today. For thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on the land. I invite all of us to reflect on the territories you're calling in from as we commit ourselves to gaining knowledge, forging a new culturally safe relationship, and contributing to reconciliation. Next slide. Whenever I read the land acknowledgement, I always want to reflect on how we're doing currently in terms of addressing injustices perpetrated towards Indigenous people, past and present. And one area, of course, that comes to mind relates to vaccination rates. We know we've done a great job in rural Ontario in getting those vaccine rates up in Indigenous communities. But unfortunately, in urban Ontario, it's not been the same story. And there are we know many Indigenous people in Toronto specifically who have not had the opportunity to be vaccinated. And there's many reasons behind this. And we're really lucky to work with a terrific colleague, Dr. Janet Smiley, who's really at the forefront of trying to understand and address these issues through community collaborations. Next slide. So I'm delighted today to be a moderator for this session. My name is Dr. Tara Kiran, and I'm a family physician at the St. Michael's Hospital Academic Family Health Team. I work at the Health Center at 80 Bond. I'm also a scientist at the MAP Center for Urban Health Solutions. So I'm going to be your moderator today, and I'm really delighted to welcome my fellow panelists, who I'm going to turn it over to them one at a time to just introduce themselves. I'm going to turn it over to you, Anne, first to start.
Hi, good evening, everybody. It's absolutely my pleasure to be here, and thank you so much to Dr. Kiran for inviting me. I'm a pediatrician at both sites of Unity Health Toronto, and I'm really excited to be talking about COVID-19 for vaccines in kids aged 5 to 11 years. It's one of my huge passions, and I'm looking forward to addressing people's questions today.
Brenda.
Good evening, everyone. So my name is Brenda Chang. I'm the clinical pharmacist at our 80 Bond Health Center, working with Dr. Tara Kiran. I'm also the clinical pharmacist at our 61 Queen Family Practice Clinic. And I've been involved with our previous COVID-19 vaccine town halls. So I welcome everyone to be back if you're joining us again the second time.
Laura.
Hi, everyone. My name's Laura Drygas. I'm a registered nurse. I work at the Family Health Team at the Wellesley St. Jamestown Health Center, formerly at the 410 Clinic. So may know some of the patients that might be on the line.
Linda Weber. You're just on mute, Linda. That has to happen at least once every Zoom session.
Exactly. I am Linda Weber. I'm a family doctor at the St. Joseph Health Center Urban Family Health Team, and I'm happy to be back again for this town hall.
Sarah.
Hi, everyone. I'm Sarah. I'm the clinical nurse specialist in the department, and I've been helping with these town halls, and I help write some of these patient communications you likely read.
Next slide. So in addition to the people you see, and you'll see us as we speak, we also have a number of people behind the scenes who've supported this to be a success, and that includes Naseem Vahidi, our terrific patient and community engagement specialist, Mark Kanash, our senior virtual education specialist, who's controlling all that IT in the background, and Krim Bradbury, social worker who helped support some of the background for this session. Next slide. I think it's important, because we're going to be talking about vaccines, just to let you know that all of the people who are gathered here today to answer your questions, we're all health professionals, and we do not have any relationship with pharmaceutical companies manufacturing COVID-19 vaccines. Next slide. We've got a great agenda for you today. We're going to start really by talking about third doses, the importance, the benefits, and who's eligible and where you can get it. And then we're going to move to the great news of the kids' vaccines that are now been approved and will soon start to get into children's arms here in Ontario. We'll talk about the nitty-gritty around, what the vaccine is all about, the safety, the efficacy, and we'll answer some of the top questions that you have. And then we'll also end with giving you guys some tips about how you might be able to deal with children's fear and anxiety and prepare them for having a successful vaccine appointment. Next slide. We prepared this session using the questions that you submitted to us when you registered. So we took those very seriously, and I'm displaying here just some of the top questions that we received that we are going to make sure that we address today. Next slide. But in addition to those questions that we know that you put in advance, we also want this to be interactive. So Mark, if you can go to the next slide, I think it'll just show you here how you can interact and tell us what other questions you may have that haven't been addressed. So we appreciate if you could put your questions in the Q&A box. If you see and the other thing to do is when you go to the Q&A box, if you see that someone else has written a question there, please vote it up with a thumbs up if you like that question and it's a question you have too. And what I'm going to do as the moderator is if I see that there are lots of questions that have been voted up and that are at the top, I'm going to prioritize that our panelists answer that question. We're going to answer some of those questions orally as we speak, and some of the questions might be answered through typing by some of our panelists. In addition to the Q&A, there's also a chat function. And what I'd suggest with the chat is, if you have comments, if you have resources to share, if you want to network with other people, please do use that chat. But if you have questions, it makes it a little easier for us if you can put that into the Q&A box. So if you can do that, that would be terrific. Next slide. Just a few things to keep in mind as we get started. This is a public forum and we are recording the session. Please do share mindfully. So, anything you put into the chat is visible to others. It's probably not a good place to ask personal health questions about personal health conditions. That's best addressed directly with your healthcare provider. Of course, we really, ask that all attendees use respectful language, free of discrimination, harassment, and bullying. We are holding this town hall in English today, but it is with closed captioning. If you feel like you have further accommodation needs, or there's others who are patients who do require that, please do let us know so that we can be better prepared for our next session. I guess lastly to say is that, we're going to give you the most up-to-date, accurate information based on our current knowledge and the current policies and evidence. But as you know, things with COVID are always changing because new evidence and policies are coming to play all the time. So just keep that in mind as you watch this session. Next slide. So I wanted to start just by setting some of the context about where we're in today. So what this slide shows is really the cases of COVID, new cases of COVID, since the beginning of the pandemic until now. And we see those new cases in red, and we see new deaths from COVID here in blue. And what we can see, of course, is that we had these terrible waves back in January and again in the spring. And now things have, thankfully settled down. But I know that many of us are worried because what you can see now is that there's a tiny uptick. It looks like an uptick. And we don't know how far up that uptick is going to go. And we know that in places like Europe, they're actually in a fifth wave. They've got quite a big uptake now. And so how can we address that? How can we continue to keep ourselves and our loved ones, our communities safe, knowing that we're heading into winter, a time when people, are usually gathering indoors more and where we know often there's an increased risk of spreading COVID. Next slide. I think one of the, most fundamental pieces is that we have to continue to practice our public health measures. And I love this new article that just came out from the BMJ that really demonstrates how effective that particularly mask wearing and physical distancing is in terms of preventing COVID. So just remember, when you're in settings, especially crowded, confined settings, wear your mask. You should actually probably avoid those settings if you can, but wear a mask and keep your physical distance. Those are ways in which you can avoid getting COVID and spreading it to others. Next slide. The other key, of course, is to ensure that we test, trace, isolate, support. And it was terrific to see the governments put out a strategy to say, we're going to try and make testing even more available and low barrier for all Ontarians this winter. So they're going to expand access to testing within pharmacies, and that includes take-home tests. So you can get a kit from the pharmacy, take it home, do the kit yourself, and then drop it back. They're also going to do similar kinds of take-home tests at schools, and they're also going to supplement that with rapid test kits that they're going to be providing at schools. And then lastly, they're going to have more mobile testing blitzes over the holiday period. So lots of strategies in store for trying to keep us safe. I will just say, you know, I have a couple of young kids, and I myself did one of those take-home tests a couple of months ago for them, and it's really easy to do. So do look into that option if you feel like, wow, it's such a headache to go book an appointment. It's hard to get that at a testing center. Know that this option is a really good one for you to do, and actually picks up COVID quite well. Next slide. I think and then of course the last piece that we are going to talk about here in terms of keeping ourselves safe and preventing a fifth wave is vaccination. And it's so incredible that we have high vaccination rates now. And this slide is just a reminder that people with who are vaccinated are generally doing really well. And the people who are ending up in hospital and in the ICU, unfortunately, are those people in the orange line who are unvaccinated. But even among people who are fully vaccinated, we see that there's maybe a little bit of an indication that, you know, their hospitalizations and ICU rates are rising just maybe a tiny bit. And that, I think, to me, speaks to the importance and the value of third doses, which is what we're going to talk about today. And then, of course, the other thing we're talking about is that population that hasn't gotten their COVID vaccine yet, children aged 5 to 11. Next slide. So as I mentioned, terrific that 86% of Ontarians are fully vaccinated and 89% have at least one dose. And you can see on that graph, it really varies by age group. And I can't wait to have more of that 5 to 11-year-old vaccinated. Someone did say to me that maybe we should stop calling people with 2 doses fully vaccinated, because for some people now 3 doses really should be considered a primary series. And we're going to talk a little bit more about that shortly. Next slide. So third doses, what do we know about them, and why should you get them? I'm going to turn it over to Brenda Chang, our pharmacist, to walk us through some of the evidence and tell you who's eligible and why you should bother to go out and get that third dose if you are. Brenda?
Great, thanks, Tara. So I'm just going to spend a little bit of time talking about why our third dose is recommended. And like Tara said, we are now referring to this term as third doses rather than a booster, because for some of our population, the third dose may be considered as part of the complete series of vaccination to get you fully protected rather than as an additional booster. And some of the nuances of that we'll go through as we talk a little bit more about eligibility as well further down throughout this presentation. So what we know is that there is some evidence of breakthrough infections over time. And we certainly saw that as we continued on with this pandemic and into the 4th wave. But really important to note is that those fully vaccinated, so at this point, we were considering most people with the 2 doses as fully vaccinated. What we saw was that they continue to have really low risk of infection and milder infections despite having some of these breakthrough infections compared to those who were not vaccinated at all. And just as a reminder, for the 2 vaccines that are the mRNA type vaccines, so the Pfizer vaccine and the Moderna vaccine, the vaccine efficacy against severe disease is excellent. So for the Pfizer vaccine, it's 75 to 100% against severe disease. And for the Moderna vaccine, it is 100%. And I am going to use the brand names for these vaccines, as I think most people have familiarity with these. So I will be referring to them by their brand names as I continue to talk about these vaccines. So that's just a reminder that we do have really good vaccine efficacy for what we have, despite seeing a little bit of breakthrough infections. However, we also have some emerging evidence that the vaccine efficacy, or how well the vaccines protect us against asymptomatic infections, so the infections that are not causing a lot of symptoms, or very mild COVID-19 cases, may decrease with time. And that the current vaccines may be less effective against the Delta variant, which could contribute to increased transmission. So the data that we're seeing now is showing that over time, so particularly around 4 to 6 months, we're seeing that the vaccine efficacy that was originally reported in the study at around 95% or so start to come down a little bit. But keep in mind that this is mainly for symptomatic infection. So we know over time, severe disease is still fully protected. So that's the real difference, is that we're just seeing some differences in numbers in terms of vaccine efficacy for more milder cases or symptomatic COVID-19, and not the severe disease that we're talking about, the ones that send our patients to the hospital. So for certain population, an additional booster dose or an additional third dose may be needed for more durable protection. And so that's the reason why we're now looking at these third doses. Next slide, please. So we also have some data that's been collected now because, as you know, millions of doses have been given worldwide. So this is just some data that I wanted to share about who may benefit from this third dose. So this is data collected and reported by the Center for Disease Control and Prevention based out of the US. So the data is across 9 different US states from 187 hospitals over about a 9-month period or so of time or so. That really looked at, based on the hospitalizations of the patients, comparing those patients who had immunocompromising conditions versus patients who didn't have any immunocompromising conditions, and looking at their vaccine efficacy rates after they fully received the 2 doses. And as you can see here, for the Pfizer vaccine and the Moderna vaccine, you know, the numbers, the percentages based on specific conditions is slightly less than that of what we were reporting with the studies for the general population of 95%. So overall, the average for the immunocompromised population or adults is about 77%. And for those who had no immunocompromising condition, about 90%. But having said that, it's really important still to note that these numbers are still great numbers. So keep in mind that if you've had 2 doses, despite the fact that you may have a rheumatological disorder or an inflammatory disorder, you know, you're still protected at close to 80%. So that is better than 0%, you know, for someone who is not vaccinated at all. So we just wanted to share that there is some differences between some of these population of patients, but certainly still great protection if you are vaccinated. Next slide, please. And in addition to that, we are seeing some data now showing that signs of decreasing protection may be greater for the older age groups, and certainly for those groups that may have clinical risk factors for more severe outcomes. So they may be patients with other medical conditions that make them easier to have more severe disease and more risks after they get COVID-19 infection. So among the people who are fully vaccinated, what we're seeing now is that the older age groups, so those 80 years and above, then followed by the group 70 to 79 years of age, have the highest hospitalization and mortality rates from COVID-19 compared to younger patients who are fully vaccinated. And so this is some of the reasons why we're seeing our ministry guidance and our national guidance to suggest that you know, in addition to those patients that we talked about earlier with immunocompromising condition, that our older population would benefit from a third dose. Next slide, please. So is there evidence really for a third dose, and how does that compare to people who've just received doses? So now we have data coming from other jurisdictions, primarily in Israel, where they have a program to provide third doses, and as well as some data coming from the UK. So I just want to share with you a little bit of data from Israel. So what you see here is a graph that compares really the individuals who receive 2 doses versus 3 doses in Israel. And this data is for the adult population. So the average age is around 52, but in Israel, they also reported data for patients over the age of 60, and we're seeing very similar trends in information. So overall, what you see in the graph portion is that for the red line that's going up, those are the people who received 2 doses. And what you see going up is the cumulative incidence of cases or events of COVID-19 infection. And as you can see, the blue line are those people who received 3 doses. And as you can see, over time, we're not seeing an increase in number of infections. So based on this study, the reported efficacy or effectiveness of a third dose, with respect to admission to hospital is 93%, for severe disease is 92%, and death at 81%. So we are definitely seeing benefits of a third dose compared to just providing 2 doses. Next slide, please. So I think I'm going to pass it over to Linda now, who will speak to the third dose eligibility criteria.
Okay, so when I think about third dose eligibility, I effectively think about 3 groups of people. So there are those that are eligible 2 months after their second dose, those that are eligible now 6 months after the second dose, and the group that will become eligible either 6 or 8 months after the second dose in the new year. So actually, I don't know, Mark, can you advance it to the next slide? I was going to talk about the 2 months after second dose first and then come back to this, if that's possible. So this is the group that first was recruited to be getting the third dose. They're the most immunocompromised. So after 2 months after the second dose, people who are actively being treated, so that means receiving chemotherapy or have had a transplant or have HIV or are on immunosuppressive drugs. So those are drugs that are often, that can be high dose steroids. That might be the more common one amongst people. And by high dose steroids would be 20 milligrams or more a day and have been on it for at least 2 weeks. Or it would be a biologic, and a lot of those end with names like MAB and NIB or MOD. That there's that link there, COVID-19 vaccine third dose recommendations from the Ministry of Health. And if you Google that and go to it and you're wondering whether one of the medications that you're taking because of the chronic disease that you have is on that list, you can peruse that whole list. Of course, you can also ask your family doctor. And for a lot of people who are on one of these immune compromising medications, they're being followed by specialists. And so specialists are often reaching out or letting you know that you're needed third dose. However, I've heard that as few as 15 to 20% of the people in this category have got their third dose yet. So we need to do a better job reaching out. So spread the word. So those are 2 months after their second dose. So let's go back to the slide before. So it's 6 months after the second dose, and I'm going to define 6 months. It's not your, okay, 6 months after June 14th means I'm not eligible until December 14th. It's actually 6 28-day months or 24 weeks or 168 days. So how do you figure out what it would have been easy if it was just the 6 months to say June 14th, then I'm due December 14th. My quick route of seeing whether my patients are eligible for a third dose when they're in and saying, can I get one today, is I add 6 months. So take the June 7th, add 6 months and make it December 7th and subtract 14 days. And so say, okay, if it's November 23rd, they're eligible. I think they might be actually eligible November 22nd, but it's my quick math is to approach it that way. So the people that can be eligible for that 6-month dose, healthcare workers, pretty much everybody that's in that first category probably already know it because they've been sent in a message from their workplace. We have 2 categories here that they talk about: elderly in congregate settings and then adults in the community over the age of 70. So actually, I'll just say adults over the age of 70 and people who are living in long-term care and retirement home would be eligible for a 3rd dose. Also Indigenous people and people who received 2 AstraZeneca doses are able to get a 3rd dose now, no matter what your age is. So then the 3rd category are the people that are under the age of 70, and you will have to wait to hear the news sometime in the new year. And they might change it to 8 months or 6 months, all depending on what the guidance is at that time. Next slide. So the other thing that is of note, and I've seen some questions in the box about, which 3rd dose. And I also know that when you go to get your 3rd dose, they're actually going to offer you a choice, as opposed to we only have Moderna or we only have Pfizer. So you're going to have to make a choice. And the truth is, it really doesn't matter. There's some question about, you've heard that it might be good to get a Pfizer dose if you've only had Moderna, and then other people are thinking, well, if I know that I tolerate Pfizer, I should get Pfizer again. I don't think there's enough research or evidence to say one way or the other. For years, when people have gotten their flu shot, you get either or, and they're both really effective, and we just really don't know the difference. And the studies are not able to be robust enough to say the subtleties. So the general consensus amongst all specialists is just take your pick, and you can decide whether you believe that it would be better to get 2 different ones or whether it's better to stay the same. In terms of the Moderna dosage, the people that are more immune compromised will be offered the full dose, and those under the age of 70 will be offered a half dose. The Pfizer dose, even if it's a booster or a 3rd dose, it will be the full dose. Next slide. So how do you book your booster dose? A lot of you will be very familiar with this because you had to book your 2nd dose. So I'm going to kind of try to help you Google search or tell you what I find to be more helpful. So there's definitely the COVID-19 Ontario.ca book vaccine, Google COVID-19 Ontario book vaccine, and you go to the site and you enter in all of this information in your health card, and and the info on the back of the health card, and you book it. I was on there booking my father-in-law's site, and it took me the longest time to figure out how to book it because there's this line that you had to tick that said, this is what you tick if you want to download your vaccine, proof of vaccine. And then it says proof of vaccine or book an appointment, all on the same line. And I kept just reading the first half and not reading the fact that that same box was to book an appointment. So void my mistake. But the other one that I find very easy to book a vaccine is through the Toronto Public Health website and mobile clinic. So if you Google Toronto Public Health mobile vaccine clinics, you will get brought to, I think it's the next slide. Can you go to the next one? You will be brought to a page like this. Now, this slide cut off the most useful piece that is when you Google that and you go to Toronto vaccine clinics, is there's this little place that you can click on, and it says daily mobile vaccine clinics. And if you click on that, you can find out where on any given day where all of the mobile vaccine clinics and that are pop up in malls, locations running on that day. So any given day that you want to go in, you can take a look and see if there's something that's there. This map also can be used, that you'll find there in each of those little buttons that say 3, that means that there's 3 locations that you could be vaccinated, and those might be pharmacies, or the one that says single blue, it will just be a single location. And what you find when you click on those is it's a location and the address of pharmacies with their phone numbers, or a vaccination clinic that you can book online at that website, at the Ontario website. Okay, next slide. So last time during first and second doses, you know that a lot of hospitals were vaccinating, and there's still some that are doing public vaccines and third doses. You will note that the absence of Unity Health on this list. So we have closed our vaccine clinics. So for the other ones, you would just have to go find out about each of them individually to find out how to book and what's happening. For Unity Health, the good news, and this will probably be brought up during the discussion about pediatric vaccines, is that the St. Joe's vaccine clinic will be opening up for children. But for third doses, at this point, it will not be. I had a patient the other day identified that they were so appreciative of the St. Joe's vaccine clinic calling them back to have their second dose and offering them an appointment. And they were expecting the same thing would happen with the third dose. And that is not the case. You will not be, nobody will be reaching out with an appointment date for you. You will need to book that vaccine yourself, or just drop in, arrange to get it, make it happen. That was one of the sites that I was talking about. Okay.
Thank you so much, Linda. I think the last slide is just that you, and we'll go to the next one, which is just that you can also get it from a pharmacy, and you can use some of these same strategies to find a pharmacy appointment. Next slide. I just put this up here is that I think some people are feeling guilty about getting their third dose, feeling that maybe they're taking a dose away from someone in a low-income country. And I guess, you know, all this to say is that the government of Ontario has purchased vaccines to have you get as third doses, and they're kind of sitting here in Ontario and Canada, and you were, you know, saying that you don't want to get that vaccine because you want it to go to a low-income country, unfortunately is not going to make it so. And so I think for myself, to try and like alleviate the guilt I feel, and to try and move towards more global vaccine equity, you know, I'm trying to advocate for patent release, but also to donate to organizations that are doing the hard work of trying to increase vaccination rates in low-income countries. Next slide. So thank you, Brenda and Linda, for walking us through, you know, the science about third doses and where you can get them. Really appreciate it. I think we're going to switch gears now, and I think our panelists have also answered a lot of questions about third doses in the Q&A. So if you have a chance, please do look at the answered column there, where there are some really terrific answers to some common questions. But the topic that we're going to move to now, where I see lots and lots of questions, is about vaccines for kids age 5 to 11, which we know was just approved in Canada on Friday. Next slide. So why is it important to get your child vaccinated? Why are we recommending this as something to do? So I'm going to turn it over to you, Anne, to tell us a little bit more about the benefits of vaccinating children against COVID. I know that some parents out there, for example, think that, oh, COVID doesn't really make children sick, so, you know, why should I bother? Maybe you could speak a little bit to that.
Sure. Thank you again for having me. And I want to really say that so many people on this panel, and also some of the viewers, have a lot of expertise in COVID-19 in children, COVID-19 vaccine for kids, that I really encourage people to speak with your healthcare provider, because there's many, many resources either from your provider or available publicly, like this amazing infographic from the University of Waterloo, which sums up many of the things that I've been stressing with my own patients, friends, and family. So I think, you know, this pandemic has been going on for close to 2 years. It's certainly true that children, we weren't seeing tons and tons of cases early on. We weren't seeing tons and tons of kids in the ICU. However, kids do get COVID-19, and especially right now, the school age, that 5 to 11 years population, is a growing proportion of the disease. Almost 1/3 of cases in Ontario are in that age group. So we are seeing kids with COVID-19, and we know that COVID-19 vaccine helps prevent the illness. So that means they're not going to get sick, they're not going to have a fever, they will not have to stay home, their parents won't have to miss work, etc. And they will have a reduced risk of something more significant, like a hospitalization, ICU admission, or even some of the complications of COVID-19, such as the lung disease or the very serious illness that we've seen in kids throughout the pandemic, which is an inflammatory syndrome called multiple inflammatory syndrome in children, or MIS-C. So by giving that vaccine, kids won't get sick, and then they will have a reduced risk of that illness. So kids do get COVID, and especially right now, they're really quite a big proportion of the cases that we're seeing.
Yeah, and I've heard that there have been 17 deaths from COVID in kids in Canada, and I would say that that's 17 too many. We shouldn't have any deaths among kids that are preventable, and now these deaths will be preventable with the vaccine, which is the terrific news. And so even though many kids have mild illness, it can still be really impactful for people's families. And also it's a little bit like, rolling the dice to say, will my child be one of those who gets more sick? And why roll the dice when you know that you can prevent that? I guess the other pieces that are spoken to in this great cartoon here is that it helps us get one step closer to returning to normal activities for children, but also for all of us in society. Next slide.
Mm-hmm.
So, I think I'm just going to go over some of the high-level pieces around the COVID vaccine, and then I'm going to turn it to Anne, because I know there's so many questions for Anne, and that she's going to answer for us. But people have been asking, how was the vaccine studied? And so it was studied in a randomized trial where there were just over 3,000 children aged 5 to 11 who were given the vaccine, who were randomized to the vaccine, and I think about 1,500, just over 1,500 who were randomized to a placebo, so not getting the vaccine. The vaccine itself was approved in the US on November 4th. And so it's important to remember that since then, we've already had 2.5 million or more US children receive one dose. So we have experience with the vaccine so far, early experience from the US as well as from the trial. The vaccine in children has very similar ingredients to the adult vaccine. There's just one new ingredient, which I've listed there on the slide. Importantly, it's only 10 micrograms. So that's 1/3 of the adult dose. And the standard dosing right now is giving 2 doses of that vaccine. In the trial, the doses were given 3 weeks apart. Now NACI, or National Advisory Committee on Immunizations, has recommended that it actually be given 8 weeks apart, and we're going to be doing that in Ontario, and we'll talk more about why that's the rationale. Next slide. The terrific news is that in the trial, it was found to be 90.7% efficacious in terms of preventing COVID illness. And it was very safe. And so, yes, there were some side effects that people had, and you can see the side effects after dose 1 and dose 2 listed here on the table. The most common side effect was pain at the injection site, followed by fatigue and then headache. So those were the 3 most common side effects. And we know that those side effects resolve generally in 1 to 2 days and are easily treated with things like over-the-counter pain relievers like Tylenol or ibuprofen. Next slide. So as I mentioned, we think there's going to be an 8-week interval between the first dose and the second dose. And why did our National Advisory Committee recommend that? Well, for one, we know from the adult dose that people who actually had the adult dose spaced out further apart had a more robust or stronger immune response. And we also think that they probably have a longer lasting immune response as well. So we think the same thing will be true for kids. We also think that a longer interval will reduce the risk of myocarditis or pericarditis. So myocarditis, pericarditis, you guys have, I'm sure, heard about as one of the more serious reactions that teens and adults could get with an mRNA vaccine, so Pfizer and Moderna. Next slide. But the good news is that the risk of myocarditis, pericarditis is a lot lower, we think, with the Pfizer vaccine for kids. Why is that? Well, first, we think that the risk relates to the amount of vaccine we administer. And it's a lower dose, as I mentioned, a third of the dose for kids versus teens and adults. And so we think that means it's going to be a lower risk of myocarditis, pericarditis. Second reason, we know physiologically that myocarditis is actually less common in kids compared to teens and adults. So just the baseline risk itself is a lot lower. Third, there's longer spacing. This longer spacing, as we talked about, between the two doses, we think will reduce the risk even further. And it's important to remember when we're talking about myocarditis, pericarditis, we're talking about a, maybe 1 in 10,000 risk among teens 12 to 15. But this was a risk of something that was generally mild. So myocarditis occurring after a vaccination is much milder than if it occurred after a COVID infection, and also easily treatable. And so usually people who receive treatment feel better within 1 to 2 days. Next slide. So this is just a illustration of the rates of myocarditis and pericarditis. And what you can see here is the rates among females in blue and males in yellow. And we can see that the rate of myocarditis, pericarditis, just generally pre-COVID, was higher in males. And we can also see that on the x-axis is the age groups, and we can see it really spiked up in that teen years, for example, 16 to 19, but was super low in the 5 to 11-year-olds. And so that's some of the data that helps to reassure us that that risk is probably going to be lower. Next slide. So that's just, I think, a high-level overview about some of the vaccine information that we have. And I want to dig deeper now into some of the questions that you guys have been asking. These questions have been are terrific. And maybe I'll start with the question actually from Carlin Van Essen, who asked, could there be any long-term effects, Anne, of the vaccine for children?
Thanks. So that question we hear quite often. And for this one, I go back to that idea of the mRNA technology, which is a technology that's been around for decades, in fact. And what the mRNA does is it goes into your cell, not into the nucleus, nowhere near your DNA, your genetic material, but to kind of the factory of your cells, and gives them instructions, like an instruction manual, how to make the spike protein that looks like the COVID spike protein. Your body sees that, then your body mounts this immune response. So that instruction system is used, the mRNA instruction system is used, and then it's gone. So based on that rationale of mRNA getting used up and no longer there, we don't expect long-term effects of the vaccine. This vaccine has been around now for a year for adults, and we haven't been seeing long-term side effects in adults as well in that 1 year period, and even longer with the trials. For the children's trials, it's shorter, but we really don't expect long-term effects because of the way the mRNA works.
Thank you. I think another common question, and this is a question from Maxine Katz. When in 2022 will the 12 to 17-year-old vaccine be available for those in 2010? My child was born in 2010 and turning 11 in December 2021. So it's kind of this question of the people that are on the cusp. How do we kind of help them decide which vaccine they should get? What's your advice?
Thank you so much, everybody. There's many of these in the Q&A, and it takes a few minutes to do your math, especially if your own children aren't in that age bracket. So what the information from Ontario was talking about is here and now in November 2021. They are saying for the starting age, born in 2016. So that means you are 5 years old or you're turning 5 years old between now and December 31st for the starting. And then they're talking about the 12-year age as, again, being born in 2009, because that age, again, is either already 12 or turning 12 by the 31st. I anticipate that once we get over the calendar year to 2022, each of those years are going to change. Does that make sense? Do I need to repeat myself on that one?
Well, maybe, and what we can do is also ask this question of like, so what happens though? So you've talked about the eligibility, but how about, does weight play into it? Suppose I have a child who's larger, who's higher weight. Should they be getting the adult dose instead of the child dose? What's your recommendation?
Sure. And before that one, just to go back to with its eligibility, if you have a child who is 11 now and turning 12 in 2022, then this 2021, they can get the dose for 5 to 11 years. And then after they're in their year turning 12, 8 weeks from their first vaccine, they'll be able to get the dose for 12 years. And thank you so much, everyone, for these questions about weight. The study that Dr. Kiran mentioned, that was the randomized control trial with about 3,000 kids aged 5 to 11 years, had kids of all sizes, just like our population is made up of short kids, tall kids, etc. So in all of those, we saw a good immune response, regardless of their weight or age. So we do know that the vaccine produces a good immune response, regardless of your age or weight. And vaccines typically aren't dosed based on a weight criteria. So I'm very comfortable with an 11-year-old, regardless of their size, getting that dose that I like to call kind of a sweet spot, because we know it mounts an excellent immune response while minimizing the discomfort. And then after they turn 12, again, based on the studies that were done showing that it's going to have an excellent immune response as well, they can have the higher dose.
Yeah, I'll just say, from my own experience, I have an 11-year-old who's turning 12 in February. And, I signed him up this morning to get the COVID vaccine, the children's pediatric dose. And I feel very comfortable with that, knowing that it's going to provide in the study, the children provided a really robust, got a really good immune response, even just from a third of the dose. So they studied that. And what they found is that children got, 5 to 11 with a third of the dose had the same immune response basically as kids 12 to 16, or maybe I think it was 16 to 25, youth 16 to 25 had with the full dose. But at the same time, the lower dose had less side effects. So in fact, I think in some ways it's a great advantage for your kid to just get the lower dose and get that protection.
Mm-hmm. And we're taking advantage of the fact that kids have great immune systems, right, and mount great immune responses.
Yeah, exactly. And so I think in terms of that second dose, my understanding is that that people can get the second dose if they're on that cusp, they can get the second dose at the adult dose, or the kids dose is okay too, that both would be actually counted. So perhaps it's unclear to me whether people will have a choice. I don't know, Anne, if you know that.
I don't know if I about the choice, but just based on what the Ontario website information, it's always giving these years and saying the that adult dose after 12. But you are correct. I also read that if you got your first dose as the low one, a second one as the low one, even after turning 12, will be correct. So thank you for adding that. So I think I really echo what you said. I'm comfortable with these kids getting vaccinated, and we want to get them vaccinated, get them back to their usual lives, help prevent COVID in their schools, in their communities, in their families, etc.
Yeah, and I mean, so I think another question that's come up, Anne, is that, Christina's asked, is the risk of severe COVID in kids higher than the risk of a severe reaction to the vaccine?
So that's an interesting question. So there were in the study no severe reactions. So if you take it from that, there are rare cases of very severe COVID-19 in kids. In fact, in Florida in the summer, they saw more than rare. They had really full ICUs of kids with severe COVID-19 illness. So it does appear at this stage, though it's very unlikely, severe COVID illness is more likely than a severe reaction to the vaccine, as none were observed in the study. And in that US experience to date, we haven't had reports of concerning severe reactions.
Great. And so some people are asking about the impact of vaccine on menstruation, on reproduction, fertility. I'm wondering if you could speak a little bit about that, Anne.
Sure. So when we're down to the age 5 to 11 years, some children do start menstruating prior to turning 12. We know in that age group, it's very normal to have highly irregular cycles. So we have to keep that in mind, regardless of a vaccine, that we would expect our young children to have irregular menstrual cycles. At the same time, we also know, many things impact a menstrual period. So your stress, your sleep, whether you've got an illness, etc. Certainly in adolescents and adults, people have reported that their periods seem to change after they get a vaccine. And it may be related to part of the immune response that is part of how your body is building that immune response, that something changes in your lining of your uterus. So I really want to emphasize here, though, that kids who are just starting to have their period are well known to have highly irregular periods. And we would always consider that as kind of part of regular early adolescence and the teenage years. Regarding fertility, there's lots of great resources out there. For example, the Pandemic Pregnancy Guide, started by a number of St. Michael's physicians, that has really followed the data in this area. And many people have become pregnant, like trying to conceive after having received their COVID-19 vaccine. Many people have been vaccinated in pregnancy. So this is totally outside of our 5 to 11 age group, but it has not been shown to impact fertility whatsoever in those who are trying to have children. I do find friends and family, again, are asking this as a long-term question. And as I said in the answer to the first question, we really aren't expecting a long-term side effect related to fertility based on getting an mRNA vaccine.
And so just a couple of quick points here. I think somebody did ask, can we really know the risk of myocarditis at this time? And I think, the issue, you're absolutely right that we do require the vaccine to have been given to tens of thousands of people over several weeks to really understand the true risk of myocarditis in children age 5 to 11. However, we have terrific experience with the older age groups, which make us think it's going to be much less common than with the older age groups. So, and I think countries like the US and Israel haven't yet seen cases of myocarditis, which is reassuring. So that's one quick question that I think has come up. I think another one, and this has come up in a couple of different forms, is just, children are not as high risk of COVID. So why now, almost after 2 years, do we need to vaccinate children immediately? Why not have a vaccination at a specific age? And I think there were others who too also just, asked a question that was similar.
So whenever manufacturer is making a drug or a vaccine, they're always tested in healthy individuals, So in this case, it was tested in adults. Adults were the target group because we were seeing more adult disease. And then the manufacturers went down in age quite quickly, almost immediately after receiving adult approvals. They started enrolling in their trials for kids, even down to as young as age 6 months, believe it or not. So it's a process that we want to happen so that we know that the scientific rigor has been followed appropriately. So that's kind of why we're ending up with the child immunization program here for age 5 to 11 years, coming around to 2 years into the pandemic, about 1 year after adult immunization. And I think now is the time, because we've done an amazing job in Ontario. Like, I can't stress enough the high proportion of our population that is vaccinated. We're not seeing those ICU admissions like we did previously. And we have more and more cases, more of what we call the burden of illness is in school-age kids. They're our sort of unvaccinated group. So now is the time to get them vaccinated and help, again, as I keep saying, protect themselves and protect that community around them. So we will stop disease transmission, stop spread, and move closer and closer to our our normal lives.
So another question that was really voted up was, how does the COVID vaccine differ from the other vaccines our children already get?
So as I mentioned, this is an mRNA vaccine. Our other childhood immunizations are not mRNA vaccines. Somebody actually, just building on that idea of testing in adults, testing in kids, you know, the childhood vaccines that have been around for many decades, some for a couple of decades, target illnesses that are illnesses in childhood primarily, though adults can also get them. And COVID-19 is an illness that started out in adults primarily, but is now going down in age. But I would say the main difference is that it is an mRNA vaccine, giving that instruction manual. So our body then makes the protein, then we make the immune response. Whereas other childhood vaccines are either a component of something that makes you sick, a virus or a bacteria, a killed virus, or a small dose of a live virus. So the technology is slightly different, but otherwise there aren't many differences. If there were more specifics, certainly I'm happy to, if the person wanted to clarify in the chat about some other specifics, I could address those.
Can the COVID-19 vaccine be mixed with flu shots for children?
Oh, yes. Thank you so much for this question. So I'm going to give the adult answer and then the kid answer. So we are so lucky that our National Advisory Committee on Immunization, which is in fact a group of volunteer experts in multiple fields, put out advice earlier in the fall for adults to say that COVID-19 vaccine can be given at the same time as any other vaccine without any spacing needed. So those on the town hall who are pregnant, for example, or were pregnant earlier in the pandemic, know you had a lot of conversation with your provider about, like, when I get my pertussis booster, when I get my COVID-19, how do I time it? How do I separate it? So now for adults, no separation, get it when you wish. I think many who have had third doses already this fall have also got it in close timing with their influenza vaccine. However, for kids, out of an abundance of caution and really an opportunity again to observe for those chances of extremely rare side effects that people have raised through the chat and the Q&A, the National Advisory Committee on Immunization is recommending that we wait 2 weeks or 14 days. So if you're going next week, next Monday, say for the vaccine, look back, what day was it that I went for that flu vaccine? Was it more than 2 Mondays ago? Then I'm good.
Yeah, and I think at the same time, I don't think it's an absolute contraindication. So, you know, there are some discretionary times where I think you may still be allowed to get that, but it's a preference out of an abundance of caution, as Dr. Ann says. So, and it's not from a safety perspective, but more just to understand if you get a reaction, was it because of the flu shot or was it because of the COVID vaccine? And we really do want to disentangle that. And do you have any sense of when kids under 5 might be eligible for the vaccine?
I wish I did. I wish I had a crystal ball. I will say that Pfizer is doing studies, as I mentioned, down to age 6 months. At the same time, also Moderna has been doing studies. I think theirs only went to the not all the way that young, but that may have changed. And they've already submitted for approval. So soon we'll have Moderna for 5 to 11 as well. So I can't say when we anticipate in toddlers and infants, but it certainly will come in the time ahead as we move to the next phase of the pandemic.
2022, let's hope.
Yeah, let's hope. Let's hope.
So one last question for you live, and then I'll let you take a couple others just through typing afterwards. But the last question live is just from Robert Bodner, who says, it seems that Canada is always behind the United States in approval of vaccines, boosters, or what group gets the vaccine. We have fine physicians and scientists. Why is it the US always leads?
I think it's a numbers game. Thank you so much for that question. You know, their population, someone will correct me, but isn't it 10 times larger than ours? So there are just more manufacturers, more scientists, et cetera, et cetera. And we don't lag very far behind at all. I mean, this approval in the United States was November 4th, and ours was, I think, the 19th. So that's not bad, 15 days difference. I really see us as a very important player, in fact, on the vaccine stage. going back historically, Canada was huge in the development of a number of vaccines. We also have some amazing vaccine startup companies across the country whose vaccines will come onto the playing field at some point as well. So I actually don't see us as being all that much behind.
Thanks, Anne. So, Mark, I'm going to ask you just to skip over to the slide, making vaccines easier for your child. And as you do that, I'm just going to say that, you know, in terms of booking the appointment for your child, it's very similar to the stuff we reviewed for third doses. Right now, the provincial booking system is your best bet, but over the next few days and weeks, there will be more options that are opened up. Hopefully some that will include some options in your school. And you know, our family health teams are also here to support you. So if you're a patient of the St. Michael's Hospital Academic Family Health Team, you can, you know, just dial and press 8 and our clerical staff will help you with that. At St. Mike's, we are providing booster shots at our Saturday clinics, but at this time we're focusing our resources really on providing essential primary care services. So we're not providing kids vaccines in our clinics. However, we're going to reassess that in the new year if we see that there's a need for that. And then, as Linda mentioned, I think that the St. Joe's clinics are going to be doing the kids vaccine, and I think that's more information for that is going to be coming in shortly. So right now, I'm going to just turn it over to Laura. Laura, are you able to talk a little bit about preparing your child for vaccination? I know somebody in the chat just asked, you know, should I give my kid Tylenol? I've booked them for Saturday. So maybe you can speak a bit about preparing and what we should do.
Yeah, absolutely. Thanks so much. And thanks again for having me. So I'm going to be speaking to some tips and some things that you can do to prepare your child for vaccines and hopefully make the whole experience a little bit easier. You know, as a big part of my job, I give a lot of needles to a lot of kiddos, and just to say that it's so common and so normal for kids to have some anxiety, some fear, and some worries about getting their vaccine and getting their needles. So, you know, we can go to the first slide. I think one of the first things I would say is that it's so important for us to sort of do as much as we can to try to normalize, you know, immunizations and vaccines as part of our routine care for seeing our family doctors and for staying healthy. One of the most important things that you can do is to try and discuss getting the vaccine with your kids. Try to, as a caregiver, stay calm and confident when you're talking with your child about what to expect. Kids are very smart, and so, you know, if kids will pick up on if you're having any anxieties yourself or any worries. So it is really important to talk with your kids and answer all their questions. As far as giving Tylenol before the appointment, for the most part, and the doctors on the line can chime in here, it's not really necessary to give Tylenol or ibuprofen before the immunization appointment. If after the immunization, you know, your child is having significant pain or discomfort or maybe a fever, then you can give Tylenol or ibuprofen if needed, but not necessarily necessary to give before the appointment. So as far as preparing, again, talking with your kids about how they're feeling, especially this age group of 5 to 11, right? Where they're very smart, they know what's coming. And so, you know, there's varying degrees of maybe anxiety or fear amongst kids. Some kids are totally fine, but even if they're not worried, I think it's still good to have conversations about what they can expect. Be honest with your kids. So I think telling them that they may feel a little poke or a pinch and maybe some pressure for a few seconds is important. Telling them that it won't hurt at all is not as helpful as you would think. I mean, you know, your child, every child is different, but in general, just letting them know what they're going to expect is really important. And then as we learned, obviously, you know, in this presentation, it's so important to get this vaccine and to get most vaccines. So talking to your kids about the COVID vaccine and the actual benefits, you know, that they might experience, and you know your kids, so you know what might be an incentive for them. So getting back to regular activities, for example, if it's something that they haven't been able to do, you know, whether it's swimming lessons or, you know, indoor play dates or things like that, to talk to them about those, and also talk to them about, you know, protection for family and friends as well. And then, the other thing we can do is plan ahead. So talk about some distractions, some calming strategies that you're going to use. So through talking with your kids about the vaccine, they may identify specific things that they're worried about. And so once you identify that, it's helpful to then talk about what you're going to do to help them through those specific worries that they might have. You can go to the next slide. So what to bring? So bringing a toy, a comfort object, something that helps them feel safe and relaxed. And this can be for all ages of kids, something that they might have that they know will make them feel more comfortable. Can consider a topical anesthetic. So there's numbing creams and patches that you can get that would be placed at the top of their arm, right here, their deltoid muscle. You don't need a prescription for these from your doctor. You can go to the pharmacy. They are over the counter, and the instructions on how to administer them are on these anesthetics. And generally it's about 30 to 60 minutes before your vaccine appointment is when you would put them on. Wear something light and loose, something that easily shows your upper arm, so there's not a whole lot of struggling with clothing when you're there at the appointment, and something that's generally comfortable for you. I would also say in preparing, try to make sure that your kids have had a snack, or they've eaten ahead of time, or they're not overtired. This is all going to help to make the whole vaccine experience a lot more successful. And then the last thing would be maybe plan for something fun to do after the appointment, or a reward for a job well done when it's all done. And you can even focus on this and talk about this as well as you're preparing for the appointment. You can go to the next slide. So some distraction and relaxation techniques. So belly breathing, slow breathing, focusing on something else. So if you have a story or a song or something to sing that will distract your child a little bit, so they're not focusing so much on the needle and the immunization. Again, I said bring some toys, so anything that they want, some special item, books even to read a story, in the waiting room and also during the appointment, music, and finally electronic devices. All of these things can be very helpful as some distraction and relaxation techniques during the appointment. Next slide. And then positions. So there's multiple different positions that the vaccinator, the nurse or the doctor that's there may suggest to make your child more comfortable. This is just one of them. I do like this position. It does help for kids that, maybe don't want to look at the needle, or they just want some extra comfort to sit with their caregiver. And you can see the positioning here, how they're nice and cradled, and the caregiver is holding their elbow, and the child can turn their head away, or they can even look at the needle. Some kids actually prefer to look, so they know what to expect, but this is something that you can do ahead of time to prepare your child. So you can even practice this position at home, and practice, what would happen, so the child knows what to expect. Next slide. And after the appointment, so celebrate, praise, positive reinforcement works for kids of all ages, and to know that they're going to need to come back again in 8 weeks to get dose number 2. So the more praise they can get, it can be really, really helpful. Of course, remember to sit and wait for 15 minutes after the appointment. You can bring a snack or a drink, something to have outside of the facility, and whatever that reward is that you've agreed on, whether it's something fun to do or some kind of treat or something like that, now is a good time to have that. And then again, as far as acetaminophen or ibuprofen, okay to give that after the immunization if they're having significant pain the day after. Last slide. So this is just a nice little graphic that kind of summarizes some of the points that I mentioned. And so this is a card. So the CARD kind of helps you to remember things you can do to help your child through their vaccination appointment. So comfort, ask, talk to them about how they're feeling, relax, try to remember the things that you identify, to stay distracted and to stay relaxed. So hopefully those tips were helpful. I think that's the end of my presentation. Thanks, everyone.
Thanks so much, Laura. I'm going to go to the next slide, and I'm just going to share a few other tips for folks in terms of we've gone over a lot of information today, and I think it's hard to probably remember it all. And you may also want to do more research afterwards. And so I think one of the key things here is that if you're going to if you have worries about the vaccine questions, it's really important to get your information from a trusted source. And so we try to be that trusted source for you today. If you have further questions, and I know some of you have put some very specific ones into the chat or the Q&A, feel free to reach out and make an appointment with your healthcare provider. That's always a terrific idea. But here are also some other resources that you can turn to and feel good about. Next slide. So one that I really like is called Kids Health First. And Nasim can put this link in the chat for you. It's a website that's curated by the Children's COVID-19 Vaccine Table. Associate Medical Officer Health Dr. Vanita Dubé is one of the people behind this website, and it's supported by many different children's hospitals across Ontario. So this is a terrific, and we will maybe, Nasim as well, we can send out these links to these websites and resources for people afterwards to look as well. Next slide. I really like this website as well. It's called Max the Vax, and this one is actually pulled together by a family doctor, Amanda Adams, who works up in Markham. She got some funding from the Canadian Medical Association and did this work together with other healthcare organizations and community organizations. And it has not just like answers to your common questions, but it also has some terrific videos and interviews and some really fun stuff to get kids engaged into the vaccine education kind of process. Next slide. I've been peripherally involved with this group at the University of Waterloo School of Pharmacy, which is like a group of physicians and pharmacists and scientists who come together to try and provide like just accessible COVID-19 vaccination information for people. And so you saw that earlier infographic, and one thing I'd highly recommend is this 2-page frequently asked questions document that really, I think, would answer a lot of your questions very succinctly. Next slide. And this one is from the Hospital for Sick Kids about kids' health. Next slide. I think that the Hospital for Sick Kids, also one of the terrific things they have is a COVID vaccine consult service. So if you feel like you're not getting the answers you want from your healthcare provider, or maybe you don't have one, and you want someone to spend more time with you, you can book a vaccine consult here. Anyone can do that, and they'll take the time to answer your questions individualized for you. Next slide. And this last one is just a terrific resource for everyone out there. So, many of us may know people who have still not gotten their first or their second dose. Maybe you're struggling with whether to get your third dose, or you have questions about the vaccine in children. This is a terrific resource called VaxFax. It's put together by a family physician in Scarborough, Dr. Latif Murji, and you can call and book an appointment, and they take appointments from all across Canada now. So, and they have a lot of experience in being able to share just really factual information with people. Next slide. So, I think we've actually answered pretty much all of your questions today. There's no open questions in the Q&A, and I think we've managed to answer most of the ones from the chat as well. I think somebody did ask whether the slides will be available, but just to say even better than that, I'm sure the recording will be available, and I know that Nasim will be sending that out to everybody who registered, and perhaps even more broadly to all of our patients for whom we have email addresses. So we'll definitely continue to keep you up to date with information through the terrific communications that Sarah Nestico and Nasim Vahidi and others pulled together for us. Next slide. So finally, if you have any questions, of course, you know where to find us, and you can visit our website. And we do put on our websites just the wonderful communications that do go out. So if you ever need to access those and take a look again, take a look at our websites. Finally, I'm going to just thank all of our panelists who took the time to be here today and answer your questions. So thank you to all, to Anne, our pediatrician, Brenda, our our pharmacist, to Linda, a fellow family physician, Laura and Sarah, our fellow nurses, and to the team behind the scenes, Nassim and Mark Kanash in particular, who did so much of the organization behind today. Thank you so much. And thank you to all of you for sharing your knowledge and your questions. We're here for you all through the pandemic. Our clinics have been open, and we would love to converse with you one-on-one if you continue to have questions. So thank you, and good evening.